Hi, I'm Beth Salcedo. I'm the medical director of the Ross Center, and I'm here socially distanced from Greta Hirsch.
I am the clinical director, and Beth and I, even though you may be seeing us on the same page, we are in our separate offices.
We are here because we want to let everyone know that we are fully operational. We have administrative staff, our psychiatrists and our psychotherapists currently seeing both new and previous patients over our video conferencing platform. We want to let you know that we believe that during this time of great stress, it is very, very important to take care of your mental health. We are all in a vulnerable position right now, and our mental health really is the backbone of our good physical health and self-care. We are posting information on the practice news page of our website and on our social media on a regular basis, and we want to be sure that you are not inundated with too much information. So we are posting what we feel could be helpful for you just for managing coronavirus anxiety and good self-care. We'd also encourage you to reach out if you think that you could use treatment or if you ask about receiving treatment. We're happy to see you. We're happy to provide referrals for you in your local area. And we would also like to let you know that there's a great member organization available that has other resources. The Anxiety and Depression Association of America at www.adaa.org has a wonderful Find a Therapist page for therapists all over the country and in multiple other countries. And they also have a lot of good educational resources on their website. Greta?
I have been privileged to work as a clinical psychologist treating anxiety disorders for the last 20 plus years. Most of anxiety really involves feelings of uncertainty, and at this time, with the uncertainty that all of COVID-19 represents, it is very typical that our anxiety levels and our stress has. And one thing that our bodies, having anxiety really is an adaptive reaction to either a real or perceived threat. One can have both physical responses like increased heartbeat, shakiness, feelings of lightheadedness, and also catastrophic thoughts associated. Our vulnerability to how well we tolerate this is oftentimes determined by biological factors. Sometimes people have some discomfort or shame around their anxiety, but it is really much more about biological vulnerability. Today, I want to emphasize some good mental health practices that we would be talking about, whether it was COVID-19 or any other form of anxiety. This involves some basic rules, trying to develop some good sleep hygiene. That means I turn off most electronics a few hours before I go to sleep, and I try to go to sleep and to awaken around the same time. Limiting alcohol intake, since that interferes with sleep. Trying to maintain some structure and some exercise because that keeps us both physically and mentally healthy. Very important at this time to also recognize that just because we're asked to be physically distant from others, that should not create emotional distance from others. Zoom, telephone calls, a lot of various platforms should allow us to be connected with others, even if some of these activities we're doing virtually. One other important factor, especially for the anxious mind, which is always looking for solutions, is to really limit the amount of information that you're getting from the news. I would suggest looking at a reliable site like the CDC, NIH, or World Health Organization in the morning and then maybe mid-afternoon. Another important part is to try to keep some and look for some humor. When you're afraid, when you're laughing, you're not going to be able to be afraid at the same time. And then to really emphasize acts of kindness, reaching out to others, really emphasizing the we rather than the I, finding really meaning that the way to get through this is through a sense of connection and community. If you are finding that you are not tolerating well the amount of time that you're spending either scanning your body or having negative catastrophic thoughts, maybe then you can reach out to a cognitive behavioral therapist in a few sessions. They can help you build good strategies and tools for you to better manage your anxiety. I really appreciate and want to thank everyone who took the time to listen to the message that Beth and I delivered to one another. Stay healthy, and we're here if we could help you in any way.
Please take a look at the practice news section of our website, as well as each of the individual office pages for any contact information. Again, we're happy to help you with referrals or to see patients who need to be seen if anxiety is really becoming problematic for you. Take care.